Good morning, ladies and gentlemen, dear colleagues. You can imagine how honored and privileged I feel to be part of this Chinese ITI meeting. And I'm supposed now to cover or to give the prosthodontist's point of view when it comes to aesthetic implant complications. That was the plan of my presentation. You have seen that now Professor Belser has given the definition. He talked about incidence, origin, and causes. So I will only focus on the prosthodontic treatment possibilities which we have, and I will insist towards the end of my presentation on the preventive measures. I don't want to get you depressed. You have seen so many complicated situations, so I will try to change a little bit the final image of this problem. That is what I have prepared. I would like to start with a brief introduction and scope to define the problem, and then use the main part of my presentation to give some prosthodontic tips and tricks how we can deal with implant complications. And I do this in form of case presentations. And then try to come up with some conclusions and clinical recommendations. This is the objective in an ideal world. I hope I can convince you that this is a successful treatment result. And the ingredients are: first, healthy peri-implant soft tissues.